Good morning, Team HCTC. This is Sabrina from Human Resources here. Welcome to Open Enrollment 2020. Batten down the hatches, grab your oars, and get ready to sail through open enrollment for the next half hour or so. HR has provided so many resources to help you complete your 2020 benefits enrollment. The open enrollment page on InfoNet contains all of the documents and information you'll need to successfully complete this year's enrollment process. Linked on this InfoNet page is the 2020 Open Enrollment Guide, which contains all of the information you'll need to understand your options, including the schedule of branch visits, plan and cost comparisons, instructions on how to enroll in enterprise benefits and Paylocity, and other important information to prepare you to make your benefit selections. To know the ropes, you must read this guide. A representative from Human Resources will be visiting all the branches to answer any questions you may have about this year's open enrollment process. Check the schedule on the Open Enrollment InfoNet page to see when we'll be in your office. In addition, Brad Shattuck from Benecom will also be making branch visits to assist you with your AFLAC and MetLaw enrollment questions. Please note, Brad and his representative will be unable to assist you with filing claims during these visits. They can only assist you with answering questions about new enrollments or cancellations and changes to your existing products. Open Enrollment 2020 begins November 6th and will close on November 27th. Enrollment is mandatory for every benefit-eligible employee. You have 3 weeks to log into Enterprise Benefits and Paylocity to either make your election or waive your benefits for 2020. Please note the date that Brad with Benecom and HR will be visiting your branches to ensure all your questions are answered prior to enrollment. Before you navigate to Enterprise Benefits, be sure to verify your name and address are correct in Paylocity self-service portal. You make changes in this module, and those changes will feed into Enterprise Benefits. Name changes require supporting documentation and will be approved by HR after verification of those documents. Once you've confirmed your contact information is correct, simply navigate to Enterprise Benefits in the navigation box. Don't get left high and dry. If you fail to complete your enrollment by November 27th, you'll not be enrolled in benefits for 2020. So don't wait until the last minute. Remember, benefit changes can be made 24/7, even from home. Once you've enrolled, save or print your confirmation page. This is your proof of what you elected. Check your junk folder if you don't receive that notification immediately after completing enrollment. Don't abandon ship before you've verified beneficiaries. Be sure to review your beneficiaries listed in Enterprise Benefits to ensure all information is up to date and you've designated a primary and secondary beneficiary. The beneficiaries listed in Enterprise Benefits are for all life and all state products. If you wish to review or update beneficiaries for your 457 or Florida Retirement System plan, you may do so through accessing your online accounts or by requesting a change form from HR. Run a tight ship and make sure that everyone in your family is covered. If you add or change dependents for 2020, you must provide supporting documentation. You may need to provide supporting documents to verify changes to currently enrolled dependents for 2020 as well. If you've provided this previously, there's no need to provide again. If documentation to verify dependents is required, it must be provided no later than November 27th, or your dependent enrollment may be canceled. We'll be offering the Passport to Wellness again in 2020. Trim your sails. Beginning January 1, 2020, you'll be required to complete 10 wellness activities to be eligible for the end of the year drawings. To make up leeway, double stamps will be given to those who receive a preventive screening, such as a Well Woman and annual physicals. Wellness programs offered through United Healthcare will be reviewed in just a few minutes. As a reminder, your completed 2019 passports with at least 7 completed activities are due to HR by December 2nd. If you want to enter the drawing for a chance to win awesome grand prizes, don't forget to turn those in. Our 10 Days of Wellness will begin December 9th. This year's top prize, an iPad courtesy of LifeLink. Don't get caught in deep water. Let's discuss the benefits offered to the tax collector employees through United Healthcare and discuss ways you can get the most of your benefits. First, we'll discuss health insurance. Do you want to save money hand over fist on your health insurance? Use in-network providers. When you receive covered services from providers in the network, you save money because these providers have agreed to provide services at a discounted rate. Whether you're home, traveling domestically, or you have a covered child going out of state for school, the United Healthcare Network providers are likely nearby. UHC's network include over 978,000 physicians and healthcare professionals, more than 6,100 hospitals, and over 67,000 pharmacies. Ahoy! Preventive care is covered in the United Healthcare Network at no cost to you. This includes immunizations and preventive health screenings that may help identify potential health problems early. We won't rock the boat in 2020. We'll continue to have two health plan options through United Healthcare. The Choice Plan remains an in-network only plan with a lower monthly premium and coinsurance once your deductible is met. The Choice Plus plan has a higher premium but allows you to go out of network. This plan has no coinsurance and a lower out-of-pocket max for in-network services. Both plans are open access, which means you don't have to select a primary care physician and you don't need a referral for a specialist. Don't rely on the scuttlebutt to make your selections. Let's review 2020 changes. While there was no increase to your monthly premiums for 2020, 3 changes were made to plan designs. As we review your coverage options in the next few slides, remember, the emergency room copay increased from $300 to $350. The deductible increased from $500 to $600 per individual and from $1,000 to $1,200 per family, with no change to your out-of-pocket max. And specialist visit copays will increase to $60 per visit unless you see a United Healthcare Tier 1 specialist. Don't be a stick in the mud. Let's review an exciting enhancement. New to our benefit program this year is the Tier 1 Specialist designation. Visiting a Tier 1 specialist ensures you're getting the best value from your benefits and keeps your specialist copay at $50 per visit. It's easy to locate the Tier 1 specialists available by specialty in the United Healthcare app. All of the Tier 1 specialists will automatically filter to the top when searching for providers. Just look for the blue dot when searching for providers on MyUHC or on the new United Healthcare app. To be sure we're on even keel, all employees on a United Healthcare plan will receive a new health insurance card in the mail for 2020 due to these plan changes we just reviewed. Be on the lookout for your new card in the mail later this year. Here are the benefit options of our Choice Health Plan at a glance. More information about the Choice Plan can be found on the Open Enrollment Infonet site and in the For Your Benefit Open Enrollment newsletter. Remember to review these resources thoroughly so you're not taken aback when making your selections in enterprise benefits. Forging ahead, we look at the Choice Plus Health Plan at a glance. More information about the Choice Plus plan can also be found on the Open Enrollment Infonet site and in the newsletter. Please review these plans in detail and use the resources HR has made available to you to ensure you make the right plan choice for you, your family, and your budget. The United Healthcare Prescription Drug List, or the PDL, is the list of medications covered by the plan and is organized by cost levels, known as tiers. Choosing medications in the lower tier helps you save money. Get the lay of the land by reviewing the information available on Infonet, including a list of changes to tiers for 2020. Are you on daily maintenance medication? The Optum Rx home delivery program makes it easy for you to receive a 3-month supply of your medication by mail and save money in the process. You can save the equivalent of a half a copay with each 3-month supply order. The tax collector's office offers flexible spending accounts for all benefit eligible employees. A flexible spending account allows you to set aside tax-free money to pay for qualified expenses. There are two kinds of FSAs you can choose from: healthcare and dependent care. Enrollment in both types of FSAs is available in Enterprise Benefits and Paylocity. Are you wondering how the flexible spending account works? Don't miss the mark. First, estimate your expenses for the year and decide how much money you want to set aside. Money will be set aside into a flexible spending account from each paycheck after the plan year starts, which is January 1. You pay no taxes on the amount of money that is put into your flexible spending account, and then you can use your FSA funds to pay for eligible expenses using pre-tax dollars. With the Healthcare Flexible Spending Account, you may set aside up to $2,700 for eligible medical, dental, and vision expenses for you or your eligible dependents in 2020. Please note, this amount is the FSA dollar amount limit set by the IRS. You'll have access to 100% of the healthcare FSA amount you elect for the year effective January 1, 2020. Remember, your FSA benefit is use it or lose it. Don't get hung over the barrel. If the funds go unused, you'll forfeit the balance, so be sure to plan carefully before deciding how much money you want to set aside in your FSA. You'll have until March 15th, 2021 to incur expenses for the 2020 plan year. Also, since the Healthcare FSA is a tax-free account, be sure to keep your receipts as proof you used your funds for eligible expenses. To help you keep your FSA expense records shipshape, your Healthcare Flexible Spending Account will come with a Healthcare Spending Card Debit MasterCard to make paying easier. You must re-enroll for this benefit every year. If you elected the Healthcare FSA in 2019, be sure to keep your 2019 debit card. The amount you elect in 2020 will be loaded on your FSA card on January 1, 2020. Contact United Healthcare directly for replacement cards. With the Dependent Care Flexible Spending Account, you may set aside up to $5,000 for eligible child and elder care expenses in 2020. Unlike the Healthcare FSA, you'll only have access to money set aside after you've contributed it from your paycheck. Also, make sure to save your receipts. Unlike the Healthcare FSA, there is not a spending card for the Dependent Care FSA. Therefore, you must submit your paid receipt for reimbursement as funds become available in your account. Contact HR with further questions. Don't forget, activate your myuhc.com account to help you manage your benefits in healthcare. This site will help you weather any storm by allowing you to find network providers and provider locations, check your account balances, manage your claims, track expenses and pay your bills, estimate costs for care, learn about covered preventive care, find and compare medications, refill, renew, and transfer home delivery prescriptions. Also, be sure to download the United Healthcare app. This is a new app that provides secure, on-the-go access to personalized health information, helping members better understand and use their health plan effectively. This new app replaces the Health for Me app. Members are able to hit the deck and use the new app to find care, review deductibles, copays, and coinsurance, check on the status of claims, access pharmacy information, view Optum bank balances, and contact United Healthcare with questions. Now, let's talk about the wellness programs offered through United Healthcare. These programs conveniently complement our internal wellness options. First up, Rally. This is a digital experience on myuhc.com designed to help you make healthy changes to your daily routine, set smart goals, and track your progress. Get personalized recommendations to help you move more, eat better, and improve your health, and have fun doing it. Earn credits for taking healthy actions, connect with a community of people, and get the support you need to stay motivated. We encourage you to go overboard and explore Rally today. Simply Engage rewards you for your health actions you and your covered spouse complete. This wellness incentive program is only available for employees and spouses with United Healthcare medical coverage. You and your spouse can each earn up to $200 annually for completing health actions such as biometric screenings, health surveys, and wellness coaching. Gung ho for Simply Engaged? You can also earn rally coins to enter into sweepstakes, get discounts, or make donations for completing health actions. Whether you want to lose a lot of weight or just a few extra pounds, Real Appeal is designed to help with simple steps and support along the way for lasting weight loss. As a benefit of your health plan, Real Appeal includes a personalized transformation coach who'll guide you in customized steps to fit your needs, personal preferences, medical history, and goals, 24/7 online support, and a mobile app to help you stay on track and reach your goals, a success kit featuring a personal blender, digital food scale, and more. Real Appeal is offered at no cost to you if you're enrolled in the United Healthcare Health Plan. This is not a fly-by-night weight loss program. It works if you work it. The Quit for Life program is designed to help you to overcome tobacco dependency, featuring the latest in digital and online tools such as a website, app, Quit Coach, text messaging, and more. The Quit for Life program is there for your support. Receive access to a website to download the Quit Guide. This features tips to help you overcome urges, manage withdrawal symptoms, and change your daily habits to avoid tobacco triggers. The site also features other tools such as a cost savings calculator, live tobacco-free courses, quizzes, and more. Quit for Life is available to you at no cost if you're enrolled in the United Healthcare Health Plan. Fend off those nicotine cravings with a team to support your individual needs. Feeling down in the doldrums? When you don't feel well or your child is sick, the last thing you want to do is leave the comfort of your home to sit in a waiting room. And lucky for you, you don't have to. A virtual visit lets you see and talk to a doctor from your mobile device or home computer when you're feeling under the weather and want to get back to your routine quickly. And best of all, the copay for this virtual visit? It's just $10. Is a virtual visit right for you? Virtual visits are used to treat minor illnesses such as allergies, cold, pink eye, rashes, cough, and more. A doctor is available in a couple shakes. You should choose other care if you require a hands-on exam, need a test, or may have a sprain or broken bone. Help is always just a call, email, or web chat away. United Healthcare's dedicated customer care team is available by phone or online to answer any questions you may have. As a member, you have advocates available to help you find information and resources, as well as 24/7 access to a registered nurse. Simply call the number on your ID card. Bite the bullet and give them a call to explore options available to you. UHC provides you support designed to help you save time and money and find care when you need it. Advocate for Me services offer you access to a wide range of health and well-being information during regular business hours Monday through Friday. They make sure your benefits fit the bill. As a member, you can reach United Healthcare by calling the number listed on your health plan ID card or by logging into myuhc.com and clicking the call or chat button. Feeling blue? If you have concerns related to work or personal life, the Employee Assistance Program, or EAP, can help. This program gives you confidential support to help with depression, stress and anxiety, relationship difficulties, financial and legal resources, child and elder care support, substance use disorder and recovery, and so much more. The Employee Assistance Program is available at no cost to you if enrolled in United Healthcare Health Plan. If you don't enroll in United Healthcare Health Plan, you can't use their EAP services. However, there are EAP services available to all employees through Hartford, and we'll discuss these services available in just a few slides. Congratulations, baby's on the way. The Maternity Support Program provides expectant mothers with support before, during, and after pregnancy. When you enroll in the program, You'll be able to work with a maternity nurse who's available to answer questions and provide educational information. It's best to enroll within the first 12 weeks of pregnancy, but you can start through week 34. You can enroll by calling the number on your health plan ID card. You also have access to United Healthcare Healthy Pregnancy app, which offers nurse support and resources to help support for a healthier pregnancy. The maternity support program is available to you at no cost if enrolled in a United Healthcare plan. This should be a mainstay of any pregnancy. When you or a loved one have cancer, you have a lot of questions. United Healthcare also offers a cancer support program with a dedicated cancer nurse to help you find information and emotional support for you and your family. The cancer support program is available to you at no cost if you're enrolled in the United Healthcare Health Plan. Holy mackerel, we've covered quite a bit of material. Be sure to reach out to United or Human Resources if you need to discuss your individual benefit questions. Forging ahead, let's review the dental plans available for the 2020 plan year. We'll continue to offer the DHMO and PPO plans in 2020. However, we heard your feedback and we've added a new type of dental insurance to expand the coverage options available. This plan is a hybrid between the DHMO and PPO plans. For approximately the same cost as the 2019 PPO plan, you may select the INO in-network only option. Our new INO has a much larger network than a DHMO and allows for unused annual max to roll over to the next year. This plan also includes a preventive max multiplier, which means the cost of preventive care such as cleaning and x-rays don't count to that annual max. The PPO plan has much higher premiums than the DHMO and INO plans, but it offers the largest network of providers and has out-of-network benefits. For more detailed information about the three plans and a more in-depth comparison offered in 2020, please visit the Open Enrollment Infonet page and read the Dental and Vision FAQs. To determine whether or not your dentist is in-network on each plan, visit the MyUHC website and follow the instructions outlined in the 2020 United Healthcare Dental and Vision FAQs. Good news! If you like your DHMO plan, you're able to keep the benefit at the 2019 rates. Our new INO plan is available at a lower premium than the PPO plan, has a much larger network than a DHMO, and allows for unused annual max to roll over to the next year. The preventive max multiplier applies, which means the cost of preventive care services such as cleanings and x-rays don't count towards your annual max. The PPO plan has a higher premium than our DHMO and INOs. It offers the largest network of providers and an out-of-network benefit. Be certain to plumb the depths and consider how you use your dental benefits to determine which plan is right for your circumstances. Just like the medical and vision plans, adult children can stay on your plan until the end of the calendar year in which they turn 26. No maiden voyage here. There are no changes to your vision plan for 2020. You get the same benefits for the same low per pay period cost. Stay in network for the lowest out-of-pocket cost. To determine whether or not your provider is in network, visit the MyUHC website and follow the instructions outlined in the 2020 United Healthcare Dental and Vision FAQs. Remember, your vision benefits are available for reimbursement through our flexible spending account. If you need glasses or contacts, calculate the cost into your FSA contribution amount. Just like medical and dental, adult children may remain on the plan until the end of the calendar year they reach age 26. All hands on deck. It'll be plain sailing from here. Now that we've reviewed our core benefits, let's discuss other benefits available during open enrollment. We're letting the cat out of the bag on this one. Eligible employees are automatically enrolled in disability insurance. You don't have to sign up. There continues to be no cost to employees for our short-term and long-term disability benefits. This is a benefit covered at 100% by the tax collector's office. Short-term disability is available to regular full-time, and reduced hour employees in Sick Plan B. Long-term disability is available to regular full-time and reduced hour employees in Sick Plan A or B. Eligible employees who are unable to work because of qualifying injury or illness should contact the Hartford directly to coordinate benefits. Mayday, Mayday! Did I read this right? Yep. Eligible employees may participate in the life insurance plan subject to all terms and conditions of the agreement. Life insurance provides you and your family important financial protection. The tax collector's office provides basic life insurance to benefit eligible employees at an amount equal to 1 times your base annual salary. This is provided by the tax collector's office at no cost to you. Don't get caught dragging your anchor. Consider your supplemental life insurance needs. Eligible employees are able to purchase supplemental life insurance at their own expense. Supplemental employee life is available in increments of $10,000 up to the lesser of 5 times the employee's annual salary or $500,000. Evidence of insurability is required for coverage that exceeds the guaranteed issue amount of $120,000 and when electing to increase coverage by more than $20,000 up to the guaranteed issue amount. Life insurance premium amounts are listed in the 2020 Benefits Guide on page 27. Clear the deck! Supplemental spouse life is also available in increments of $5,000 up to $250,000, except the amount elected for spouse coverage cannot exceed 50% of the employee's approved supplemental life election. In order to obtain supplemental insurance for your spouse, you must purchase and/or have additional life coverage for yourself. Spouse coverage is age-banded and based on the employee's age, and a personal health statement is required. Supplemental child life insurance covers all children up to age 19 or age 25 if a full-time student for a low monthly premium payment of $1.80 for $10,000 in coverage. Don't forget to add the child's name to the policy after the birth of a newborn. Keep an even keel. In addition to the life benefits, there are a number of other services available to tax collector employees by the Hartford, including EAP services, funeral planning, estate planning, and travel assistance. For additional information on these services, please reach out to Hartford directly and refer to the brochures on InfoNet. Let's get cracking and discuss more important voluntary benefits to consider this open enrollment. LifeLock is an employee-paid benefit available to employees that elect to enroll. It provides certain identity theft and recovery protections. Enrollment in LifeLock is not available in enterprise benefits. To enroll, you must complete an application and submit it to HR by November 27th. More information about LifeLock and the application form is available on the open enrollment page on InfoNet. If you have questions about LifeLock, contact HR or Brad Shattuck with Benecom when he visits your branch office. Let's get clued up on our legal plan available to you. Met Law Legal Plans is an employee-paid benefit offered to employees that wish to enroll. This enrollment is available in enterprise benefits. Having an experienced attorney when you need one may cost less than you think. Met Law provided you with the choice of experienced attorneys at a low monthly cost. If you have questions about Met Law, contact HR or visit Brad Shattuck with Benecom when he visits your branch office. Heave to here. Many changes are coming to the Aflac products. We will continue to offer supplemental Aflac Dental and supplemental Aflac Vision through payroll deduction in 2020. If you're currently enrolled in other Aflac products, you should plan to meet with Brad from Benecom when he visits your office. See the calendar of events on page 24 of the 2020 Open Enrollment Guide for Benecom site visit dates. Brad can advise you on how to convert your other existing Aflac products to Allstate, cancel Aflac coverage if you no longer desire it, or move to Aflac coverage direct bill at home effective January 2020. We've turned the corner in 2020. Beginning this year, we'll offer 4 voluntary group benefit plans through Allstate to supplement our health coverage. Please note, Allstate voluntary benefits are paid by the employee that wished to enroll at their own expense. You're not required to purchase this optional coverage. If you wish to enroll in one or more Allstate product, enrollment is completed through Enterprise Benefits. Premiums will be deducted pre-tax via payroll deduction unless you wish to have them deducted post-tax, in which case you'll need to contact HR to enroll. If you've not already done so, meet with Benecom Brad Shattuck when he visits our office to find out more about these new Allstate products. Over the next few slides, we're going to tie up some loose ends about the Allstate products. First, let's talk about the Allstate hospital coverage. Coverage pays a cash benefit for hospital confinements. This includes benefits for hospitalization, surgery, outpatient nursing, and transportation. Coverage is available for spouse and children. Benefits paid directly to you and paid regardless of any other coverage you may have. Premiums are affordable and payroll deducted. Cancer insurance pays cash benefits for cancer and 29 specified diseases to help with the cost of treatments and expenses as they happen. Benefits are paid directly to you unless otherwise assigned. These benefits are guaranteed issue, meaning no medical questions to answer on initial enrollment. Includes cancer coverage plus 29 specified diseases, coverage available for dependents, and a waiver of premium after 90 days of disability due to cancer for as long as your disability lasts, for the employee only. Allstate accident coverage pays you cash benefits for hospital and intensive care confinement. This plan also includes coverage for a variety of occurrences such as dismemberment, dislocation or fracture, ambulance services, physical therapy, and more. The cash benefit can be used to help pay for deductibles, treatment, rent, and more. Other things to note: this policy is guaranteed issue, meaning no medical questions to answer. Benefits are paid directly to you. Pays in addition to other insurance coverages. Coverage also available for your dependents. And the premiums are affordable and payroll deducted. With the Allstate critical illness coverage, you choose benefits to protect your family and family members if diagnosed with a critical illness. Then, if diagnosed with a critical illness, you'll receive a cash benefit based on the percentage payable for the condition. These policies are guaranteed issued, meaning no medical questions to answer at initial enrollment. Coverage available for dependents. Covered dependents receive 50% of the basic benefit amount. Benefits paid regardless of any other medical or disability plan coverage. Premiums are affordable and payroll deducted. 25% of your basic benefit amount is paid for advanced Alzheimer's disease and advanced Parkinson's disease. See page 23 of the 2020 Benefit Guide for more information on pricing. Pricing for this critical illness coverage varies for tobacco and non-tobacco users. Thanks for sailing through your benefits with me today. Remember that the last day to make elections in Enterprise Benefits is November 27th. Only you can decide if you'll sink or swim, but don't worry. If you still have questions after reviewing the 2020 Open Enrollment Guide and InfoNet page, HR will be with you through thick and thin. Feel free to reach out to me, Sabrina Permuth, at extension 5215 or by email, or Jennifer Castro at extension 5254 or by email. Thank you for your time, and I hope you enjoyed this Wise Guy Wednesday Open Enrollment installment. May you have fair winds and following seas.